If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle. Got a really cool guest here with us this time, Ken McDonald. He's a pro with fitness industry, his own business company in the fitness realm, working with golf and tennis athletes. So, man, I appreciate you coming on, sharing some knowledge bombs.
Thanks. I appreciate it, Kyle. Thanks for having me on.
But tell us more, exactly where you're at Lifetime Performance, Palm Beach Gardens, where you're at, who you're working with.
Yeah, we're close by, about 10 minutes down the road. Lifetime Performance is the name of the company. We've been in operation for about 13 years now. Like you said, we deal with all kinds of clientele. I would say our niche is in golf. We work with professional golfers, amateur golfers, junior golfers, tennis as well, and then general population. I would say typically with kind of a focus on post-rehabilitation or people that are coming off injuries. We have a pretty decent background and knowledge of anatomy and kind of, where you want to take some of these clients after either they've had concerns about exercise or they've had injuries, that sort of thing. But like you said, my background is as a pro golfer, so that's kind of how I got started.
Yeah, I was going to ask, what ultimately led you to be like, I want to work with golfers as my niche?
Probably by accident. I had no formal education during my college years. I went to the University of Richmond, played golf there all 4 years, and turned pro. Played pro golf for about 5 years and realized at some point, you know what, I don't think this is going to work. And at the time, I was getting into the fitness world as a client of a personal trainer, and that helped my game a lot. And then I realized...
At the University of Richmond?
No, this is actually after I graduated, right, when I turned pro. I was working at PGA National part-time, and I was also training with one of the coaches there. Helped my game a lot, and I realized, you know what, maybe I should start working a little bit in this field just in case golf doesn't work out. And I started to go to get my personal training certification through AFA way back in the day, and started doing that and loved it. I think it was mostly because I liked, being around people and helping people. Yeah. And just kind of seeing the difference it made, obviously with their golf, but with their life as well.
Yeah, totally.
So that's kind of how it started. It wasn't anything that had a real formal education on it. Just sort of snowballed after that.
And recently, several years in a row, you've been recognized as one of the top 50 golf fitness trainers in the nation, right?
Yeah. So Golf Digest puts out a top 50 every 2 years, I believe. So I been fortunate enough the last 4 years to be on that list. And
that's cool. Congrats.
Yeah. Thanks, man. I appreciate that.
That's a great recognition. So, I would imagine, very similar, I would imagine with your previous athletic endeavors, kind of living vicariously through your clientele, seeing yourself in them, which pours your passion and heart into that too. Yeah. Would you agree with that?
Yeah, I do. And I've kind of lived that life as a pro golfer, traveling all over the place and trying to manage a lot of different things and obviously play well and, enjoy it. That's the other aspect of things. So I would say, I am passionate about working with the mini tour guys, the guys that are just getting out of college and they're trying to making sure they're getting on the right programming. They have enough information about what they have to do to prepare before they play, the type of workouts they should be doing, the diet, all those sorts of things. So I love being kind of a part of that team. And I really liked the transformation that I made, as a pro golfer into this world because it kind of kept me in the sport. Right. Without actually playing.
Yeah, totally.
I get to play on occasion here, but not too often.
Yeah. I was going to say too that like the niche with the people coming off of maybe issues, injuries, maybe apprehensive, not confident, everything always hurt. Like something always goes wrong and hurts. That's a great niche, because a lot of people that otherwise you can instill confidence in and a completely different trajectory for their fitness and stuff and instilling the right pathways.
Yeah, I think it's a balance that you have to find, especially with golfers, because they're athletes, but I wouldn't compare them necessarily to like hockey players or football players or baseball players. Yeah. Those guys tend to have a little bit more resiliency in them. They move a little bit differently. So with the golfers, they swing obviously a golf club repetitively over and over in one direction all the time. So
it's the same thing over and over again. Yeah.
As you know, as a physical therapist, the overuse injury is something that is very common, and just trying to get them to stop doing that a little bit is very challenging. So, being there, having done that before, I kind of speak with some experience to that. But it's something that I love because, like I said, as I said before, I get to help people on a day-to-day basis. And
so do you find yourself recommending to your golf athletes, let's dial down the golf practice and swing volume dial up maybe fitness, nutrition, back in again? Is it come waves like that?
Yeah, it kind of depends on the athlete and how much they practice. I have some guys that will just bang balls, 200 balls a session. And they seem to have no problems. They come in for the workout, everything is fine. There's other guys that have injuries all the time. As you know, it's just kind of, everyone's sort of different. So you kind of have to manage them differently a little bit. But by and large, I'm telling them that at this point in their career, they don't need to be hitting as many balls as maybe they think they need to be hitting. Now, obviously, if they're going through swing changes or they're trying to groove a new pattern or something, yes, that requires a lot of hitting. But these guys are so good at this point that, yes, they can get better, but is more and more and more actually going to make a big difference to that. So, or is it going to be more of an issue to the body if they keep doing that?
Right. With that being said, like, is hammering and practicing a ton, since they're already really good, the skills are there, what would make the difference then for those individuals?
Well, I've always been a big advocate of playing as much as you can and then putting yourself in tournament situations as much as you can.
So trying to replicate tournament situations.
They would call that variable practice if you were to incorporate that into your practice itself, where you are putting something on the line when you're playing. One thing I do tell them is try to hit, maybe 30 balls in 30 minutes and see if you can do that. Basically just kind of putting a little pressure on each shot, taking a full minute to go through it. It's really hard to do that. It's hard to hit 10 balls in 10 minutes because you want to kind of rifle through there. So that would be kind of an idea like that, or playing for money, not just money, but certain games that put pressure on you. Trying to replicate it as
pressure situations.
Pressure situations, exactly. But again, playing tournaments. I've worked with a lot of guys that don't play a lot of tournaments. They just practice. Maybe they'll play a little bit throughout the year. And I think that's detrimental. I think getting yourself in that tournament mindset as much as possible is a good thing. Now, it kind of depends on their age with that. I'm kind of giving that advice more for, a pro golfer, a pro athlete. If we're talking about a junior athlete, it might be a little different. They might be doing too much of that already. And we see that a lot with tennis and golf.
Yeah. Mm-hmm. Yeah. We've seen a lot of tennis guys too, because tennis is another big population you guys work with.
Yep. I grew up playing tennis. Switched to golf freshman year in high school, but tennis, the rotational sports, and it just ended up being that, we focused on tennis and golf. Golf is obvious from my background, but tennis was something that sort of evolved into. There wasn't a lot of facilities that were working specifically with tennis players. So with the tennis athlete, the junior athlete, one of my issues is always getting to the point across to the parents that, as they develop, as they get older, the timeline for how much they need to be playing on the court starts to change a little bit. They don't need to be doing as much. They probably need to be spending more time on their fitness level in general. It's a good rule of thumb that however old they are, that's about how many hours a week they should be playing or practicing or playing tournaments. So if there's something that 15 years old, I would say it's going to be okay to be 15 to 20 hours a week doing that. 20 is pushing it a little bit. There's some good studies that talk about once you exceed that number, there's a breakdown typically in percentages of injuries, but also burnout with these kids. They start,
I can imagine,
just not wanting to play, and it just becomes like a job to them. And that's my ultimate goal of like, okay, we don't want this to happen. We don't want it to get like this. Golf is maybe a little bit different. I don't think we see quite as much of it in golf, but certainly the individual sports. And a lot of that too is because they are playing year round. Being a great state here in Florida, the weather's great. Yeah. There's a lot of pressure on the parents to have the kid play all year round. They don't
to excel.
They're going to think that he might get lapped, by other kids. Now, I don't know where you grew up. I grew up in New Jersey. I ended up playing, getting a scholarship to play golf, but I played golf maybe 5 months out of the year, and then I played hockey the other season. And
you played hockey? That's cool.
It wasn't anything that was, I never thought of being like, oh my gosh, I got to move down to Florida for half the year to be able to get good at this game. Now, maybe it would have helped, maybe it wouldn't have. I don't know.
Yeah.
But the evidence doesn't suggest necessarily that you have to be totally specified into one sport early on.
That's what I've read.
It kind of depends on the sport. Now, gymnastics, figure skating, yes, you need to be able to devote basically your whole life to it. Tennis, maybe on some degree, but as you get into the team sports, absolutely doesn't at all.
Yeah, I've actually heard the opposite, where it's like multi-sport for team sports. Mm-hmm. It's going to help the over.
That's what I meant.
The
it's going to help. Yeah,
and the carryover, the transfer, and ultimately help other sports. Yeah. With some of the injuries and people that you mentioned, like you have a niche, great work niche. People that aren't really confident, they have issues in the past. They've always had some kind of problem with training, and then you guys are a good avenue to like, this is safe. Right? This is like low impact. Mm-hmm. We're going to help things feel better. What are some of the main injuries you see for the golfers that come see you?
Oh man, it's across the board. Obviously, low back is a big one. Lead shoulder is one. Lately, we've had a lot of hip impingements. People coming in with a cam or pincer impingement that's causing like an FAI or a labral tear.
Okay.
So those are, that's a rotational sport. So the spine's going to get beat up, the hip's going to get beat up.
Yeah.
On occasion elbows, but really it's low back, and I think that's kind of one area I feel like we do a pretty good job with. I don't know why, just maybe my background on it and working with a lot of athletes who've had back issues, and kind of back to your point, making it somewhat of feel like a safe environment. I mean,
Right.
we always like our clients to feel like, when they walk out, especially after the first couple sessions, like, okay, I could have done a little more.
Yeah.
That wasn't like
right.
brutal.
We say that all the time in our patients, right?
Mm-hmm.
Like when you're leaving, like, because we deal with injury, that's what we do. So definitely a lot of like delicate situations and like testing the threshold, but not too much. I'm like, when you leave here, you should feel better than when you came in. As in like, my back feels like better right now, right?
Yeah.
After I did all this stuff, hey, let's highlight that. It's a great win. You feel better. Versus like, I did a lot of stuff and it hurts now, but I know I worked on things. It's like, that's a net negative right now because we're lighting things up more. Like, we want to avoid that. So you guys are very similar then. Like leaving, they should be like, I feel like I could have done more. Hey, that's okay though. We don't like.
Right. Yeah. And, I think part of it too is, especially if they've had a lot of injuries, which sometimes, we'll go through a health history, it'll take half an hour. Just because they've had a lot of surgeries, a lot of injuries, they have some concerns about it. But getting kind of rid of that fear of movement, as you probably know, is very impactful.
Yeah.
Making the client feel like, okay, I can move. It's not going to, further injure the issue or the site.
Right.
And that's kind of a win, I think, is getting them comfortable with knowing they can come in there and use their body as much as they can without feeling like, they've really exerted themselves to the point that they might get hurt.
Right.
And then, of course, as we go, we kind of in a linear fashion sort of build upon that through sets,
Progress appropriately.
reps,
Yeah.
right, intensities, changing the movements up a little bit.
Yeah.
But we have some rules of thumb that we follow kind of as a group at our company that we, if someone comes in and they've got shoulder impingement, what we're going to rule out and what we're going to put in. Same with knees, same with low back. So we kind of have a system in terms of like, generally speaking, these exercises are going to be very good. And these are the ones we're going to throw out, at least for now.
Right. Kind of working around it.
Yeah, because there are no, like you always hear that there's no bad exercises really, but not everyone's built for every exercise. I mean, the deadlift and the squat is a great example of that.
Yeah.
You can watch 5 people squat and be like, 2 of those guys, maybe they should be able to squat with weight on their back properly. The other 3 have no business doing it. So we're going to have to work something else in there, maybe make a single leg variation or whatever. Yeah. So, acknowledging that through the assessment process, seeing that is helpful because, we'll kind of understand like loads and compression forces and torque. And that's the stuff you kind of want to avoid when they have something like a low back problem.
I know you guys have a pretty robust assessment sometimes 30 minutes, which is great. Get a full
that's just
deep dive.
The 30 minutes is just the talking.
Okay.
Yeah. The hour, it's another hour after that of actual movement. Yeah.
Walk us through some of the assessment stuff you guys usually do. Let's say someone comes in with hip pain or shoulder pain, whatever. What kind of stuff?
So it's generally speaking, we do, I've been doing this long enough. I have some elements of a lot of different certifications that I like that we've kind of evolved into our assessment process. Some from the SFMA, Golf Digest, for instance, has a new certification. We use some of their screenings, especially if we're with a golfer. TPI obviously had a huge influence. So a lot of our stuff is probably somewhat physical therapy based, but I think the easiest way to kind of explain is we'll have the client do the first half of the movements kind of on their own, where we show them what to do and we want to see how they do it. And then the second half of it is we put them on a table and we just kind of see what sort of range of motion they have, flexibility they have, how the joints move. And then we'll throw in some strength assessments and power assessments if it's appropriate for the client. Now, if they come in with an injury, so for instance, if we're looking at the hip, speaking about the hip, there's a couple tests we'll do just to kind of see, okay, is this a significant hip issue? Is this something that could cause a problem?
Right.
And so we would have them do an overhead deep squat to start, and that's going to test the kind of kinematics of how the hip moves and if there's a compression or impingement at the hip joint as they get down into the squat. And usually they'll feel this in the anterior portion of the hip. It'll feel like a pinching, maybe a little pain, a grab. We might have them do some single leg rotations where they're rotating their pelvis over kind of a planted single leg. That can kind of look a little bit at the labrum and the hip joint itself to see if there's any pain there. We'll also put them on the table, and then we'll look at actually how the hip moves, if we can kind of recreate that compression or that pinching feeling in the hip, which I'm sure you're very familiar with, a hip flexion 90 degrees, adduction and internal rotation. Everyone probably pinches with that, but you can kind of tell where you're running into a wall with that.
Pathology.
Yeah, the pathology of the hip. So if you try a little adduction and there's no movement, try a little hip and it's somewhere around 10 degrees, and then you look and they've got 50 or 60 degrees of hip external rotation. You're like, okay, we got either a retroverted hip or there's something else going on in there.
A lot of limitations.
Yeah, a lot of limitations in the hip joint. So you can also do a Faber test, where you're putting the ankle over the knee and you're dropping the knee out to see if there's any pulling that's, let's say, outside of the normal feeling or pain. That might be checking labrum. So yeah, that would be an example of kind of like how we would kind of get a detailed look at the hip. Now, if we find that person goes through that and they're like, yeah, everything feels pretty good, no problem. All right, that's maybe they just got some sort of soft tissue issue in there. There's not necessarily a structural problem.
Right. So you guys, all right, so that's awesome. I mean, talking first, past history of some stuff, get an idea of where they're at and what they're looking for too, goals, I would assume.
Yep. Oh yeah.
And then go through like a movement screen, some testing, some range of motion, then some strength testing.
Yeah. So we'll build upon that. We'll do some strength testing, and this could just look like an actual workout. Sometimes we'll have them do some incline push-ups, some TRX rows. We will test their leg strength by doing kind of like a perceived 8-rep max test where we give them some weight, have them do 3 reps in a split squat. If they feel like they can get 8, then we stop them at 3 and add more weight until we get to the point where they feel like they can't do it anymore. So generally a safe test you can do to get an idea where their strength is.
Right.
Look at pull-ups for upper body strength, and we'll do some power stuff too.
Yeah. And then from there is when you're like, all right, with this being said, and based on what your goals are, here's the plan that we're going to develop for you.
Yeah.
How often do people usually come in per week?
I usually tell clients on average people come in about twice a week.
Yeah.
Say if they want really good results, 3 days a week is a little bit better than 2. 2 is still good.
Yeah.
1 is okay if you're doing a lot of the stuff on your own.
Right.
So I would say that 2 is a sweet spot because that gives us a chance to get a full body workout both days.
Yeah. Our sessions are usually an hour and a half or just
about 60 minutes, but sometimes we go longer. Yeah, there's no real, we don't top it necessarily.
Yeah. That's good.
Well, this in the social environment too.
Right.
When we train people in mostly a semi-private setting, so people get to know who they are and they want to talk.
Yeah.
Going through the same type of punishment.
Yeah, which is good. That's a good way to like build rapport. You know, it's like we're going through the same thing. This sucks, but it's okay though. It's a beneficial thing.
Yeah.
What are some of the most common questions that clients usually ask you?
I guess it depends on the client. If they're there for golf, it's far and away, how can I get more distance? How can I get more flexibility?
That's distance. What's the answer? What do you guys usually find yourself doing?
Distance is usually, we take them through the evaluation. Usually we can see or get an idea about I say mobility is always number one for that.
If they can actually get into positions.
If they can get in positions to create speed. A lot of it is, can they actually get in positions that allow their body to create time to create speed? Dr. Greg Rose talks a lot about this through TPI, where he talks about, you got to take a guy like Bubba Watson, you look at his swing, he's not deadlifting 300 pounds off the ground, but he's hitting that ball 350 yards sometimes. He's got long limbs. He can get those hands really high. He can create a lot of time to create that kind of speed. So mobility is a prerequisite for that. If you don't have any of that mobility, it kind of makes everything a little bit harder. The strength, most golfers have, I should say most, I would say a majority, more than other sports, to say would have enough strength to play their sport at a high level. You don't have to be super strong to play really good golf. There are some baselines we like to see our players meet, but I would say that's secondary to the mobility aspect. And then the actual power, the fast twitch aspect of things, how much force they can put into the grounds, how explosive they are. We could test that with a vertical jump. I actually have them swing a golf club with a radar. We look at how fast they swing a speed stick, and we look at how fast they actually hit a drive. And that gives me an idea of what kind of speed they're capable of creating, and then where they're at. Like, are you going to be able to play at a really high level with the club head speed you have now? Because there's more and more research that's coming out, obviously looking at the guys who play the best, typically the guys that hit it the furthest. Yeah. So it's becoming a really important element in golf. I think I answered your question.
How do you what do you see the sport going 10 years from now, right? If distance is always being challenged and like gaining, but more and more the edge, you know what I mean? Mm-hmm. Guys are hitting it 350 yards, Bryson DeChambeau, he's crushing it. Versus like in the 70s when it was like a way different story.
Yeah, accuracy, short game putting, all that stuff. Yeah.
Right.
I see it continue going on the trend that it's going. Unless they even if they do roll back like ball regulations and club regulations, you're still going to have guys that hurt further, and that's probably going to put more of an emphasis on the physical aspect.
Yeah,
of
right. I
things.
was going to say,
if
so do you see them standardizing like the club, really, like
that I can't speak
and
to.
standardize the golf ball?
I don't know if they're going to do that, but that's something they've always talked about doing.
Yeah.
Or I don't know if it's standardizing as much as putting a limit on it.
Gotcha.
How far the ball can, I guess the technology behind the making of the ball, what they can do to make it go far. But like I said, it's going to put more of an emphasis on bringing, I would say, more, athletes into the sport. Guys that might be playing basketball or football. Now, if they're playing golf, watch out. You know what I mean? That could be a real recipe for guys that are not afraid to win and hit the ball a long way.
And like athletic freaks. That can, like,
athletic freaks is a good example.
Skill on top of that. And that's like, I've always felt the same way with like youth athletes. I'm sure you're very similar, right? Like coaching athletes in the past, youth athlete, being one of those in the past too. Like I want to get bigger, stronger, faster. There's a ceiling. Like you don't have the capacity yet with a mature enough body to actually put a lot of strength and size on, and you're growing a ton, right?
Right.
So that being said, then focusing on like the skill set first, the motor control and coordination, which is the highest risk of injury with a lack of motor control coordination for youth athletes. And then once you have those skills down and motor control coordination, and then when they grow up a little bit more and they can actually sustain that with their frame, then you layer on strength on top of that and power on top of those skills that are already developed. That's when you get like high-level athletes. Do you agree with that? Like, what are your thoughts on that?
Yeah, and I think that's the argument for, if you're having this discussion with a parent, when should I start my kid? And that's a good argument to have, to say like, probably 12 years old is a good time for them to start getting into the gym.
For like strength training, you're saying?
Well, not even that. I would say more of, like you said, the skill acquisition, movements, make sure they can move their body under control well. Yeah. And, they have to be able to handle all that. Once they're going through puberty and they're changing, their body's changing, everything's kind of awkward.
Yeah.
Everything's tight. Mm-hmm. They're going to have aches and pains a lot. So, that's not necessarily the time to be putting heavy bars on their back or having them deadlift a lot. It's more the time to work on the speed of movement. It's more the time to work on the technical aspect of things.
Right, skill acquisition. Yeah.
And so once they start hitting that kind of, and boys are a little later than girls, but once they start hitting that like 15, 16-year-old, and some kids obviously develop faster, you can start loading them up. Testosterone is kind of flowing through these kids, and all of a sudden muscles start developing, and they can start putting up some crazy weights. Now, as golfers, we don't always, it depends on the athlete, the individual, what they are capable of getting back to that. I'm not afraid to try to get someone bigger and stronger, for sure. We try to do that with everybody, but there's some bodies that are going to respond much better to that. And those are the ones that we might pursue it a little bit more with.
Right.
That makes sense.
Prioritize that more with certain body types and individuals, and then prioritize maybe mobility and other body types. That makes total sense. With the with adolescents, right? Young kids growing a lot, adding skill acquisition. I hear a lot. They're like, I feel so tight. My hamstrings are tight. My back feels tight. And from what we found in the research, right, it's the muscles tissues grow slower than the bones, and the bones are growing faster than the muscles can keep up with. So I'm like, man, static stretching. I mean, we want to dynamically warm up, get things prepared to tolerate intense fitness activity for sure, to lower the risk of injury. But I'm like, gaining more range of motion, soft tissue isn't going to fix that tightness problem. You're just growing a ton right now. This is the same. You hear that a lot at yours.
Yeah, and it's funny you said that. I mean, I just tell the parents to be patient.
Yeah.
This is just a process they're going through. Not every kid has this, but some kids do have some of these pains. So, this is the time where you might want to consider taking them out of the sport for a little bit, especially if, let's say, like Osgood-Schlatters disease or something. And
it's something I battled a lot.
Severs, stuff that's kind of growing related. Because when you use that, when you run, when you sprint, when you're jumping, when you're doing all these things, it's firing it up, and it's just making the kid maybe miserable to some extent. It hurts. And
maybe develop compensation patterns because they're trying to avoid the pain to begin. So it might be a net negative of like motor control.
Right, exactly. So
that makes sense. Yeah. I battled Osgood-Schlatters disease growing up and Severs disease. And if y'all aren't familiar, Osgood-Schlatters disease is on the front of the kneecap and the tibial tubercle of the tibia. The quad patellar tendon is stronger than the bone insertion to itself. And so there's like an avulsion fracture, a separation of the bone tissue of the vulnerable growth plates. And that can lead to like a bump on the front of the tibia. And it just really hurts, right? Severs disease is the same concept of, it's like an apophysitis. They call it apophysitis, right? The Achilles tendon, as it pulls on the calcaneus, the tissue is stronger than the growth plate connection, and it separates an avulsion moment of the growth plate on the calcaneus. So it's really painful to touch, and it hurts a lot with running. Right on the base of the heel on the Achilles insertion site. But anyway, for youth athletes, that's a super common thing. Medial elbow pain for the epicondyle of the elbow, apophysitis, little leaguer's elbow, and then same thing with little leaguer's shoulder. Right on the insertion point for the greater tubercle of the humerus. But anyway, those are just avulsion moments for y'all who are familiar. But I'm sure you see that a lot. I would imagine tennis players more than golfers.
Yeah.
Where they're like getting after it with agility and power and acceleration.
I mean, it is, and that's, a lot of it's kind of talking the parents off the ledge a little bit. Like it's okay. Like it's not we'll check it out. Obviously we usually send them to an orthopedic or a physical therapist just to get a good idea of what it is so the parents can have a better understanding of it. But it's painful and it hurts. And, and when you're trying to train through that, obviously we're just going to avoid it. There's no let's get stronger to make it better. If that makes sense.
So you're just going to back down the volume, modify the effort a little bit just to maintain and moderate symptoms. Because it makes total sense. Like if they're going to play through that, and it's not like there's compensation patterns that could be developed avoiding pain, because athletes are the best compensators, right? They just get the job done, whatever it takes, not knowing that they're maybe developing issues and movement patterns that are not the best. And then it takes more effort to unlearn those compensation patterns and poor movement patterns than it is to like just start with a clean slate. Mm-hmm. At least what I found, right? Do you see a lot of golfers then that you work with that are like, there's some movement things we need to unlearn before we add more things?
Yes. Usually I would say the first couple sessions, we take them through basic movements. We're looking at hinge, we're looking at split squat variations, single leg balance, just generally how they control their movement under load, maybe a little bit of load, definitely body weight and gravity. Yeah. And if that's kind of what you're talking about, yes, we will make obviously changes to make sure that when they do load these areas, it's the muscles are handling the load more than the joints, if that makes sense. Yep. But so many guys, and you see this, I mean, when I screen people, so many guys can't do a full squat. And in most cases, not every case, but in a lot of cases, the ankles are limited in dorsiflexion, right? Mm-hmm. So that's a great example of looking up down the chain first if you got a knee injury or hip problem, and especially if they're an athlete like tennis, how are they moving at the ankle joint? If that ankle joint is super locked up and stiff, it's got to be addressed at some point. Yeah. Some of it's improvable, some of it maybe not.
There's a lower ceiling for some people.
There's a lower ceiling. And there's some joints that don't always respond as well. And I think, being a trainer, having an understanding of that, and especially there's a lot of our clients that come in that are very educated. They've seen a lot on Instagram, or they've done their own research. Yeah. Sometimes they'll think everything's fixable. Everything can be fixed. We can make that ankle joint move to 20 degrees, no problem. From zero. And you and I know in the world of like a couple degrees can make a big difference.
True.
Especially with hands-on therapy. So, keeping things realistic. And I think, like I said, as a trainer or coach, relaying that to the client, saying like, this is what we can expect. This is realistic to some degree. Obviously, the hard, with mobility, we always give people, let's say if someone comes in, they're a golfer and they have a lot of restrictions in mobility, thoracic spine's really stiff, hips are a little stiff. We give them programs to do every day, because mobility is something that you can't just do like a general strength training program for like twice a week or three times a week. That's something you have to stay on top of.
A little more consistent.
Right. Yeah. Especially if you're a golfer and you're doing this for a living. You're trying to get better. And the other thing is when you do, over time, you will increase if you do it consistently. If you've ever done yoga for a long time, you know that things start to get a little bit easier. Yeah. You kind of have to be so regimented and disciplined with it. So as you get better, and you kind of like, okay, I'm getting a little bit better. But there are some of those areas of the body that just aren't going to respond quite as well. So, just identifying that, making modifications within the programming based off of that.
Yeah. With the season coming up, I would imagine you guys probably have a lot of influx of more of the snowbirds coming down, and then the golf and tennis athletes that enjoy the nice temperate weather in the wintertime here compared to like up north. Do you guys get pretty busy then, like coming up in the season?
Yeah, we're going to be. I'm anticipating we're going to be very busy, and that's a good thing. It always makes it more of a fun environment. Working with a lot of
more
people
robust.
In there. Yeah,
and you guys are expanding your spot.
Yeah, we're doubling the size. We're going to be about 5,000 square feet, and we're probably going to officially kind of open in like 3 weeks. That's what we're hoping for. That's
awesome.
So thank you.
That's really cool. And how many trainers? How many What staff you guys have on board with you?
Right now we've got 4. We're probably going to be around 5. And we're hoping to maybe get a little bit more. We're kind of working into the new space, seeing how things look and where we're going to put equipment, what equipment we're going to get. So yeah.
That's cool. What kind of criteria do you look for to bring someone on your team?
Obviously it's nice having a background in fitness certifications and education through school and everything like that. That's not always the case when you're looking for someone to bring them on, unfortunately. However, I would also argue that's not always the most important thing. Making sure, Mike Boyle used to say, like, you can't teach nice.
Yeah,
culture, the willingness to learn. When I throw 5 books at them in the first couple months, I want to see if they're going to actually read them, to get better and improve. So yeah, just that kind of ability to meet people at their level. I always say personality plasticity. You're going to have to deal with a lot of personalities.
Yeah, that's a good way to put it.
You're going to have to find ways to connect with these people because, they're the reason we have a job. They're coming in here every day because they like coming. Number one, they like coming. And number two, they feel like they're getting something out of it.
Right.
So we have to be that person that kind of welcomes them in and makes them feel comfortable.
From your perspective, going from that, I would imagine you guys all go through a lot of the same protocols and training and onboarding process and stuff to make sure that you guys are all speaking the same lingo. Mm-hmm. What does like the workout look like for you guys? All right, we did the assessment, they're going well. What does that usually look like day to day? People come in for the workouts.
You mean like what the structure of their workouts?
Yeah.
How is it designed? So, I have a lot of templates that I've kind of designed over the years. There are a few that I typically start people out on, depending on where they're at. If someone comes in now, are you speaking in terms of like the trainers and getting to know those exercises, or more like the clientele?
Clientele.
Okay, so let's say someone who's never worked out before, they come in, they've never been at a gym. Typically, that program is going to be a little bit more floor based to start out. We're going to do a little more activation techniques, learning how to turn on their glutes a little bit, using some cueing to get them to learn how to use their abdominals a little bit, contract in the right areas. Yeah. I would say what we typically do is the first 3 exercises we would circuit through. They're just core specific. It's usually like let's say a hip activation type exercise, an abdominal activation type exercise, and like a posture exercise. And we would circuit through those 2 or 3 times just to give them a feel of what they should be doing. And then we finish the second half of that session with a 5 exercise circuit. And this is going to look like a bilateral knee dominant exercise paired with a horizontal row. That would be like a TRX row, paired with like a single leg balance or a single leg kind of hip dominant pattern. Stuff that I'm sure you've read about and probably your listeners know a little bit about how to program. Maybe a core exercise in there. But basically it's a full body workout that they're taking themselves through, and they're trying to take themselves through gravity. And the key is you can do all those exercises without adding any weight just yet. So we might use other implements or tools to assist with some of the exercises rather than making them harder right away. And that would be for someone who's never worked out before. Someone who's come in and they got a really good background, but we might jump into our typical programming. And we have a lot of different ones, but our typical one might be you come in, you go through a good, let's say, corrective exercise routine. This is usually specific to what they're trying to accomplish.
Like any limitations they have with range of motion, mobility, activation.
Correct. So they're going through maybe some thoracic spine mobilization type exercises themselves on the floor. They're slowly building themselves up from the floor. Then they get up to some more of a dynamic warm up. This might be more of like a what we call a split squat matrix, where they're squatting in different planes of motion. They're doing some shoulder activations. That's usually the first 15 minutes or so. Then we get them a little bit more dynamic. They might be doing some skipping, shuffling. We call hip twisters, little hops, small plyometric type stuff to get the heart rate up, get everything kind of ready to
blood
go.
Flow,
yeah. And then we get into the power exercises, and usually we alternate between an upper body power and a lower body power, and then we'll put in as a third exercise, sometimes like a core exercise, just to give them a little break between those 2 exercises.
Upper body power, lower body power. What are some examples you guys use a lot?
So if it's someone who's trained a lot, and even basic, upper body power might be a medicine ball type throw, a slam, a throw, a rotational throw. A lot of variations you can do with that. And basically it's just teaching them how to use the ground, how to create a little speed, and how to go close to 100% on something. A lot of people, and I see this with juniors, strangely enough, that when you get them to throw or do a power exercise, they're throwing at like 60% capacity. They're not actually throwing where they need to be throwing to have it carry over into their sport. And that's true with any kind of power exercise. So teaching them that it's okay.
Yeah.
You can go all out with
Yeah.
this. And generally speaking, those exercises are very safe to do that. When I'm coaching it, I will say start at 50%, go to 60, then 70. Get a feel for what you're trying to do before you just go all out.
Right.
So that would be an example of upper body. Lower body is going to be more of like teaching them how to land from jumping to start out. I might have them jump up onto
like
a box.
like a depth jump.
Well, I wouldn't necessarily start for the depth jump, but I might have them reach up onto their toes with their arms over their head and then quickly pull themselves down into a squat. So you're kind of replicating the deceleration forces without actually jumping.
Gotcha. Yeah.
We do a process that we might do small little hops where they focus on landing and sticking the landing, and then we'll progress to like a box jump. So you're jumping up onto something, so there's a lot less force going through your body on the landing.
Yeah.
And then only after that, we feel comfortable, they got the technique down, then we'll progress them to maybe, like you said, some depth jumps where we're stepping off a box and landing, sticking the landing. Rebound jumps off of there, hurdle jumps. That would be kind of in the lower body. We use a Pilates reformer for a lot of stuff, and they have a jump board on there where you can actually jump without gravity affecting you. This is very safe for just about everybody.
Right.
And springs or the resistance. So something explosive for the lower body.
That's
so
cool.
You can feel that.
I know a lot of the research for ACL injury, knee injuries, ankle injuries, a lot of the main mechanism is the landing component, and non-contact injuries with a land. Like Derrick Rose, right? Great example, unfortunately. But so that's awesome. You guys are focusing on the landing component.
So with tennis players, we'll do this test. We'll do it's not a triple jump test, but it'll be kind of like a hop, stick on one leg. And you'll see what are the kinematics of the ankle, knee, and hip doing on a landing, on a soft landing. Right. And that's usually really a good tell to where they might be limited in motion or actually have too much motion and not be able to control it.
Yeah. Hypermobile, unstable.
Right. Yeah. In a lot of cases with the girls that we see, women are generally speaking a little bit more mobile than men on a whole, and sometimes in that area of too much mobility. The hips got too much internal rotation, and then their glutes they don't necessarily have the strength to kind of handle the landing and keep the knee straight.
To maintain it.
Yeah. So we'll do that test, and that's really good for tennis players because it gives me, again, a good idea of we need to strengthen these areas.
Yeah. That's awesome. Okay, so you got lower body power, upper body power.
And we go on to, so the last half hour of the workout is typically strength oriented. So this is where we'll get into, we have a day 1 program and day 2 program that we alternate between. Both are total body. But for instance, they might be starting on like their first strength exercise could be like a horizontal press. This could be like a dumbbell chest press. If they're just starting out, a push-up, an incline push-up. If they're a little bit more experienced, this could be a barbell bench press. It just depends on the individual. Then we usually pair that with like a lower body exercise. So that could be a hip dominant, like a single leg hip dominant exercise. That could be like a single leg RDL, which is body weight, 2 dumbbell RDL, holding 2 dumbbells, working through there. And then usually we'll circuit through those 2 or 3 sets, and then we'll put a mobility exercise at the end. So the mobility exercise is designed to kind of get rid of some of the stiffness that sometimes comes along when you start getting very strong and lifting. So, and that's the other thing I'll add with golfers. You want to think about how you're programming squats, the deadlifts, if you are putting them in there, the bench press, because generally speaking, and Dr. Stuart McGill talks a lot about this, those exercises inherently create stiffness to be done well. Like you have to tighten things up to be able to lift a lot of weight. And that stiffness, if you do that all the time, can carry over. Obviously, you might lose the ability to have your spine create the type of 3-plane motion that you needed to create through adequate ranges of motion so you can move properly in the golf swing. So we keep that in mind, and that's kind of why we make sure mobility is still there. We're not just harping on all the strength stuff all the time. And then the last circuit is typically a 3-exercise circuit, which might do more accessory exercises. We might do a rotation exercise that's generally designed to work through the hips, not the spine as much. We'll put in a pulling exercise, like a horizontal row or maybe a vertical pull, a pull-up, something like that. But that's the gist of kind of our programming. And then we branch out from that, again, depending on how seasoned the person.
Where they're at, and what they want.
Yeah.
Do you find yourself bringing some athletes through like conditioning, high heart rate?
Yeah. So we take athletes hate the tennis players hate it, but I'll take the tennis players to the beep test.
It's the worst.
Yeah. No one likes it. Everyone's done it.
Yeah.
But it's kind of like a rudimentary way to get an idea of where they are cardiovascularly. There's apps that can kind of give you a ballpark VO2 max on where they're at. Tennis players, it should be a minimum 50. I'm very lucky if I get anyone close to that to start out. But it's a good measure of kind of their endurance overall. And that's where we'll start them. And then from the cardio training, I have separate programming PDFs that I will give them to say, okay, I want you to do this on your time. Or you can come in our gym and use our equipment. I can give you cardio programming to do here. But it's not, they're getting somewhat of a cardio workout, but I kind of expect that to happen either on the tennis court with their coach.
I was going to say, I would imagine like their conditioning, their metabolic conditioning is going to happen like on court.
I think it
coach.
should. Yeah. I mean, at least one or 2 days a week should be spent with their coach on the court where they're actually focused on conditioning.
Right.
You know, they're not necessarily hitting a lot of balls per se, but they're doing a lot of running type drills with the appropriate rest periods.
Yeah.
You know, you want to kind of make it more. I mean, the average tennis point lasts less than 10 seconds.
Right.
You know, there's not a lot of court coverage back and forth in those 10 seconds, 5-6 feet each direction. It can happen pretty quick.
With little rest breaks between each bout.
Yeah.
So they're going to get their conditioning, agility work and stuff like that with their coach on the court. And then they would focus on with you guys, the power, the strength, the movement control, mobility requirements necessary through that program.
Correct. Yeah. So we'll do a little bit of agility with them, and that is part of our tennis program where it's different than some of the golf training per se. We'll do some footwork stuff, some ankle work specifically. But yeah, I tell people that the parents, when they say we need to get them better, when they say we need to get them better, change of direction, they need to get lower to the ground, hit their shots. So that's going to come when they get stronger. When they can put more force into the ground, they can decelerate better, which means they're going to be able to accelerate better, move better. So,
and have the stability to handle that.
And have the stability to handle that, yeah. And of course, getting back to other stuff, there's other factors that come in play. Ankle range of motion is a big one.
Yeah.
Range of motion.
Totally.
So,
of course.
Again, keeping things reasonable with what to expect.
What would you say is unique about golf athletes and their training requirements versus other athletes?
I think kind of what I touched upon earlier is a good example of it is like we don't necessarily, I would say, like rule out back squatting or deadlifting. You might see some of these exercises that are more common with football.
Yep.
Lacrosse, hockey, a lot of hard lower body type lifts. We will do some for some of our golfer athletes, especially if some already have high degrees of mobility. And we need them to create a little bit more stability, but generally speaking, these exercises create a lot of stiffness. So they also, there's, a back squat, for instance, puts a lot of compression on the force. It puts a lot of rotation or compression on the spine, a lot of rotation on the spine, a lot of shear on the spine. So, that by itself, when you've got a guy hitting 200 balls sometimes a day, rotating one direction, then you're going to have him squat for like 4 sets of 5, heavy. I don't know if that's the right recipe, especially when the strength aspect of things is not necessarily a huge requirement to play great golf. Now, that being said, there's a massive confidence aspect that comes with getting stronger in the gym, I think, and being able to know that you can out-hit the guys you play with.
Yeah, totally.
Because that does translate into power.
Yeah,
it does.
Totally.
Especially if you don't have good strength to begin with. So, I would say that that's probably a big part of it, and always including some mobility and making sure the athlete's doing mobility exercises pretty continuously.
It's interesting you mentioned that. The last thing I was going to bring up was the mental health component and the confidence that you were just describing. I would imagine then, like, getting stronger, feeling more confident about yourself physique wise, you could handle things well, going into a situation like, oh, I got this, or I'm stronger than I have been, stronger than a lot of these guys. I know I can hit it further than them. I would imagine the mental component is huge for golf, right? I've always felt that like the golf is the most challenging mental sport of all of them, because it's just you, and it's just that one shot right now, right? If you muff this, like you're in the hole.
There's no instinctual movement to it,
right? And that too, right? Yeah. Exactly. And you don't get a second
reactive movement, right?
There's no reactivity. It's just like, and the ball's sitting there, and it's not even moving. But anyway, I've always felt that. Do you find that a lot with you guys with in your facility and working with the athletes that you work with, the mental health component, or finding yourself to be an aid in that to help with confidence and be in a good headspace?
I mean, I like to think we are. Obviously we handle mostly the physical aspect, and a lot of these guys have their own mental coaches on the side. But if you really think about it, so many of these guys are so skilled. It's like, what makes one guy make it and the other guy not? What I've seen, obviously a good headspace is required. You need to have that. You need to be confident in yourself. But the guys that plan and prepare, like actually write down what they're doing that day, every day, like what kind of practice they're going to have, when they're going to do it, when they're going to play golf, who they're going to play golf with. That stuff that I don't see a lot, but I do see with the guys that seem to do very well. You know,
So laying out a plan.
Yeah, they're very
day-to-day
prepared.
schedule, literally writing it down on paper.
Literally writing down, having a notebook on what they did and keeping notes. I mean, I had this, I actually reposted a video that one of my guys who's now on the PGA Tour posted last year, or I just found some stuff that he had sent me and I made it into a post. But basically it was just like, these are the notes of the day. This is what I'm doing. And I thought, you know what? More guys need to see this, because I don't think a lot of people are doing this. They're not writing down what they ate necessarily, or how they felt after their practice session, or what weights they did in the gym that day. And you know what I mean? Like just having, I think it's good just in life in general to have, you know, meaning to your day. Like, okay, I want to have a plan. I want to know what I'm doing today, because I know I'm going to be better at what I'm trying to do if I do that.
So if somebody's reaching out to you, like, hey, I want to improve my physique, my fitness, drop body fat percentage, I want to feel stronger, better cardiovascular fitness, all that stuff, right? Feel better about myself in general. You would recommend to them a part of this too. I would encourage you to write stuff down, have a plan. What's your vision? That for them too?
Yeah, you just said it. I mean, if you could do a simple 1-year vision, you know, and you can, obviously health would be a part of that. You know, what are your 3 goals? I think 3 goals is a good number to pick. Donald Miller talks about this. I don't know if you know Donald Miller, but he talks about the brain can handle about 3 things, you know, and that's maybe even pushing it a little bit. But if it's from a health standpoint, write them down and like talk, and then every day write down what your plan is to help do that. You know, and try to have that kind of vision. You know, in 1 year I'm going to be 10 pounds heavier, 10 pounds lighter. I'm going to break 70. You know, have those things in mind, because that's what reminds you every day that those are the objectives, and that's what you really want to do. And sometimes you need to be reminded of what you really want to do.
I think what I've heard with that too is, I apply in my own life, right? My own stuff, my own goals. Actually writing, there's like a 72% chance likelihood of actually achieving what you want if you actually write them down with somewhat of a plan and vision, and then accountability on top of that. Someone's like, hey, did you do that today? Well, I was going to. I just hadn't, like, dude, like, did you want this or not? You know, I'm here. I'm in your corner, right? And actually writing it down, and then accountability component. And it's totally true. I mean, for my own life, I feel like I've definitely felt that. Do you feel like you're an accountability coach also with some of your clients? Yeah,
you know, I will ask. And I honestly, if we're talking candidly here, I need to be better at that. I need to be on top of them in terms of like making sure they're prepared for their day, and having these things written out. Some guys do it naturally, like I said. Other guys, I don't know if they're doing it. But what I'm learning over the years and what I've seen, and it's like, yes, the guys who write these things down, especially like you said, the accountability aspect, if you're in a community with other people that are trying or have similar goals, making sure they know what those goals are. So you can kind of hold each other, say accountable, but at least, you know, what are you doing today to get to this vision,
right?
That sort of thing. Because, you know, that you will have better results that way. It's guaranteed. I mean, you definitely will. And the other part is you learn a lot from the actual process and the journey, because not everyone's going to make it. Very few percentage of people make it. But if the lessons they learn from trying to make it carry over into their regular life, and they get so good at it that they create these habits that once golf is over, they got a whole new life to consider. It's like, okay, what am I going to do?
Right.
You know, having those skills in place, I think, is going to be very important.
Yeah, that's cool. I mean, I have a 1,000 other questions I would ask, but I'm going to leave it here for right now, because we don't want to overload people with too many knowledge.
Fast.
I know, it's crazy, right? But tell them more, like, where can they find you? Where can they reach out to you if they have questions, if they want to reach out?
Instagram, KennyMac_LP. That's my Instagram name. They can go to the website, lifetimeperformancepbg.com.
lifetimeperformancepbg.com.
Yeah, all one word. I would say probably social media is the best place. I'm on Instagram a fair amount, but I'm not really on too many other platforms. Facebook we're on a little bit, but social media, yeah.
Cool. Well, if y'all are interested, golf, tennis, active weekend warriors, give Ken a shout on Instagram, shoot him a DM, give him a phone call, check out his website, learn more, see if you're a good fit. And if you're battling any issues or pain or anything like that, you feel like you want to be able to train harder, but you feel like you're limited right now, you can always give us a call too, and we can chat more about where you're at, what you're looking for, how we'll be able to help. But we'll get you on again soon, man. Thanks for coming on.
That was great, Kyle. Thank you, man.
Hey, hold up. As you know, we're a small local practice, and we don't run any ads or sell anything on this podcast, but it would mean the world if you could share, write a post, or word of mouth recommendation for somebody just like you that's athletic and active, that wants to live their dynamic lifestyle, and pay some good karma and pay it forward to somebody else just like you. And who knows, you could change their world, and a 10-second review could be that avenue.